ISD School Health Advisory Council General Meeting will be called to order. It is February 20th, 2024, and it is 5:02. My name is David Reed, the parent chair of this council, and we would like to welcome you and extend our appreciation for your very valuable time and talent. Ashley Cox, SHAC Secretary, will now document appointed member attendance and determine if we have a quorum.
Good evening. Has everyone signed in? Okay, appointed members, please listen for your name and respond as I call those who are present at today's meeting. Yolanda Bean Brown, Kelly Bush, Sam Chapa, Patricia Cheshire, Wes Hines, Kim Kostek, Joel Coons, Wendy Martinez, Mirtha Morales, Stephanie Myers, Casey Pena, Patricia Pena, Maria Ramirez, Anna Rodriguez, Nawasi Sherman, Teresa Times, Adrienne Ware, and anyone else I didn't call? Okay, perfect. Lee, I got you.
Did you get me? Kennington? Stephen Bingham?
Got it. And Lee, Inez. Perfect. Miss Kennington, do we have a quorum?
We have Miss Pavan also there.
Oh.
Sarah, and you got yourself.
Mm-hmm.
All right. We are very close to quorum. We need 26 and we have 24. So we did not meet quorum. That does not mean that we cannot move forward with our meeting. We're just not going to be able to do any voting tonight. So we'll still hear our presentations and go through everything. Thank you for being here. All right. So our total membership, yes. Our total membership stands at 50. We have 28 parents, 19 district staff, and 3 community representatives. Today's meeting is being recorded as a matter of public record. Please don't use jargon or acronyms. Confidential information should not be discussed. For the sake of those listening to the recorded event, we ask that anyone wishing to speak signal by standing or using a raised hand, and once you're called upon, the speaker will need to state their name and speak clearly, concisely, and at a level appropriate so your voice and any comments can be heard using a microphone. At this time, we'd like to welcome and recognize any guests present. If you will please introduce yourself and the role you represent. We'll start right over here. I'll kind of read the room.
Hi, I'm Ruth Ruckus, the Deputy Director of the Cancer Prevention and Control Platform at MD Anderson, and I'll be presenting today on Be Well Baytown. Thank you for having me.
Hi, everyone. My name is Smyra Kano, and I'm Program Manager for Be Well Baytown, also MD Anderson.
Thanks. Hi, everyone. My name is Catherine Melito. I'm the Program Engagement Coordinator for the State Environmental Agency's lead testing in school and child care program. Thanks for having me. ahead. Yes, you're next. Go ahead. Yes, thank you.
Hi, I'm Emily Olivier. I'm the district high school science specialist.
Hello, I'm Mel Dancy Robinson, the Executive Director for Communities and Schools of Baytown, and we'll be presenting for you tonight as well.
Good evening. I'm Stephanie Helm with Communities and Schools of Baytown. I am the data manager there.
I am Troy Caton. I am the program coordinator for Communities and Schools of Baytown.
My name is Harry Allen. I'm the owner of Brown Academy of Sports and the owner of 4 of y'all students at Goose Creek ISD.
We'll table the minutes for today.
One of the items that we were going to approve was the minutes, the November 28th, 2023 meeting minutes. We're going to table that, and next time we will get a quorum, and we will vote on those, and hopefully we'll get those approved.
We have one more that just arrived, but we're going to be so close to quorum.
Yeah.
All right, so you're here.
Next on the agenda, Amanda is going to present the SHAC facilitator with an officer report.
Okay, so I apologize. I'm going to stand up and kind of do this presentation. So we had the privilege here in Goose Creek of hosting Catch Community of Practice meeting. Mr. Joel Kuntz was also a part of that meeting in presenting, but we were able to collaborate with other districts from around the area and share some information about our coordinated school health efforts. So the great piece about this is just to be able to share ideas, because every SHAC is different from this district to the other districts. And so it's a wonderful way for us to communicate how we are projecting our whole child wellness, how we're implementing that, and how we're measuring that as well. One of those pieces that I did want to share with you is that part of what we do here in Goose Creek is we measure our data for coordinated school health, our CATCH program. And I'm not going to read all these numbers, but just understand that things such as like our wellness festival that you know that we hosted earlier in the year, this is just data from Q1. So this would be from September through November. This data is collected. We provide this information. We use this in our assessment, our triennial assessment at the end of the year. But just some highlights of the data that we pulled just from Q1. We had 3 of our campuses were recognized as America's Healthiest Schools. Nationwide, there was only 781 schools that were recognized in the nation. We had several applications for the Wellness Award that we just started this past year as part of the work that we all worked on as SHAC from last year. Anyone interested in applying for those awards will be able to apply in April for this year. So that's something, and again, a way that we can recognize our schools for their coordinated school efforts. We've expanded the active recess. So many of, for those of you that are in the physical activity subcommittee, we've talked about active recess and how we've expanded that. Currently, there's 7 total schools out of our elementaries that are participating in the active recess pilot. Just for Q1, we did train recess supervisors. United Way, Greater Baytown, in Chambers County came out, Day of Caring, and helped paint some of our schools, Alamo and Benuelos, and they also helped to build a garden bed, which all of those things that we're reading and pulling data from all relate to our wellness policy here in Goose Creek. You notice also that the schools are being recognized for hosting Catch Family Nights. Just from Q1, we had 7 Catch Family Nights hosted. We've approximately over 1,200 attendees at those events, which is wonderful. Just a way to engage our families and community members. We had 3 Catch trainings that we hosted to encourage professional development with 43 of our staff members. We had 88% of our campuses, K through 8, that were responding to the first 9 weeks implementation survey. So we send those Catch implementation surveys out every 9 weeks so that way we can get data to see, is it working? So just kind of an idea. And then finally down here, we had physical education cohort. We're working with 14 PE teachers. This is the second year of this cohort. They presented, so it's not just Catch presenting and training. Our PE teachers are also training others. So they're training staff members at their campuses on how to incorporate physical activity throughout the school day. They're also training one another on best practices for physical education in the classroom. And they've actually had, when I collected just Q1 data from those 14 individuals, they impacted 441 attendees at their trainings. So just taking that little snippet of data, it just really shows just from quarter to quarter what we're doing as far as coordinated school health. So this leads me to the triennial review that is coming up this year. We only do the triennial review every 3 years. And let me explain just a little bit about that. So if you notice all the way on the right-hand side of your screen, the presentation screen, the local wellness policy is a written document, right? You all have that. That's that FFA that was in your folders. You can look it up on board policy. It outlines the board district goals that establish, that evaluate, and maintain our healthy school environments. So things that are in that are things like our nutrition promotion that we do at schools, the physical activity goals that the board says, hey, we want to measure these things. Other school-based activities, one of the goals for that, for example, is number of minutes that students are allotted to eat breakfast and lunch. So that just kind of gives you a general idea of what's all included in that wellness policy. Then we have implemented a wellness plan here in the district. But prior to this, it was really difficult to understand and measure the wellness policy without a plan. Well, with the work that this SHAC has done, we developed that plan, and this is the second year now that we're measuring that policy to the plan itself. The plan is about a 30-something page document, and it outlines each activity for each one of the goals that are within that policy. So it's very, very detailed. It goes into, who's going to do these actions. It takes the data that we're pulling from the surveys, from the implementation surveys. It also is pulling like the Alliance for Healthier Generation. Ms. Times was asking me about how each school, every school in our district is doing a healthy school assessment. And that data is also being pulled into the plan to see how we're measuring that. So Lee High School turned theirs in today. Several of our elementaries have turned those healthy school assessments. So we're taking all of this data and we truly, truly, truly can see how we are as a district according to that local wellness policy, how well we're doing. So from that local wellness policy, that plan into the schools, we're really getting the data from healthy school assessment. Now it is time for us to do what we call a WellSat, or a triennial assessment of our policy to see if, hey, is there any other ways that we can enhance this? What are the numbers telling us? So what we'll need to do this year, between now and our last meeting, is form an ad hoc committee. Anyone interested in being a part of that ad hoc committee, you're welcome to email shac@gccisd. Parents are welcome to join. Staff members, community members, all welcome to be a part of that. I would need that email before March 5th, so that way we can make sure that we have our committee formed and be able to go through the WellSat, the Wellness School Assessment Tool, and ensure that we're, any recommendations that we have to change or enhance the policy, we have time to put that in process. Is there any questions on how I explain this, or any thoughts, questions, concerns about this process? Yes.
The ad hoc, I can talk loud enough.
I think we can hear you. Can you hear her?
Okay.
Just hold it. It's very...
The ad hoc committee, and you said that, us and everything, will this be extended out to the community, or can we, people that we know that might be interested, can we just tell them to email you?
Perfect. Yes. So just like we run our subcommittee meetings, if you have others that want to be a part of this, welcome to. I think we have enough representation within our SHAC. But if there's others that want to be a part of that, have them email me. We're going to set one date. It will be during the school day, 10 to 12-ish. So if that kind of gives you an idea, because we will need to sit and go through the process. But yes, to answer your question, yes, if someone is interested that you're like, hey, I think they might want to, be a great addition to this committee, definitely have them on board. So it'll be a working in person because we'll definitely be marking, highlighting, circling, talking, discussing. So it'll definitely be a working meeting. I've only done this one other time, and those that were part of the process can share that we really do need to be in person for that one. Any other questions?
All right, next on the agenda is item D. We will hear from each of the SHAC subcommittees. First, the Health Services Subcommittee.
Ms. Caldwell is out today at a conference, so she asked me to speak on her behalf, so I'm just going to read the information. The committee reviewed current curriculum and programs being offered to educate the school community over various topics, such as e-cigarette prevention, suicide awareness, substance abuse, child abuse, sex trafficking, family and dating violence, and health education. The district is considering implementation of new programs such as the Children's Assessment Center of Harris County Child and Teen Safety Matters program, offered at no cost to schools, staff, and parents. However, the committee will need more time to develop its recommendations for any supplemental resources. The committee also discussed the importance of reaching as many parents as possible with these opportunities for training and awareness. The strategies including educating the public in the areas of prevention, implementation policies, and sharing resources. We learned that the Bridge Over Troubled Waters conducts training by request in various violence prevention topics for community members and youth. And DePelsion's Children's Center is also offering suicide prevention training on April the 12th. You can scan the QR code on the screen, but all members, you were sent this via email. But these were just some of the topics that we spoke about as far as the Teen Safety Matters programming, and we're still working on those recommendations. Ms. Pena?
All for them. And oh, okay. Well, the first one on there, we had the ribbon cutting for Bakota and our vape disposal device. Yeah, this is that. Here, I'll hold it on. Okay, that was a couple of months ago. So now we have the vape device disposal over at our police station, which is a nice box when you walk into the police station, and we can dispose of the vape devices there. So that's new, and there you see a picture right there with Corporal Martinez and Amber from Bakota. And then our Narcan training we're still continuing that because of Senate Bill 629. As of January 1, we had to have a policy in place to house, store, and be able to dispose of and administer Narcan if needed, which is the opiate antagonist that is given when there's a possible overdose. Student or employee or overdose in process. So we are in the process of doing that. We have right now our nurses, our police, our security, our nurses, our athletic trainers at the high schools, our principals, and our APs have all been trained to administer Narcan, and we are all stocking the Narcan. The Senate bill is only for 6th through 12th grade, but we are stocking it at every campus to include our early learning centers. So that is a plus. And again, the added ones are our trainers at our high schools. They have that also stocked and in their offices. And then our HPV, our All for Them, is going full force. We just had our first one at the high school level at Lee a couple of weeks ago, and I believe we had 45 or 44 students that received vaccines. And our next one is Sterling High School. No, I'm sorry, Impact. We're going to have one over the spring break, And then we continue on with Sterling and our other high schools, and we're just continuing that with UT Health and our HPV initiative. And that's it. Any questions? No? Okay.
Next item is D2, the Health and Health Education, Physical Education, and Physical Activity and Fitness Subcommittee report and district input.
Okay, so I was a part of that subcommittee as well. So I'm going to speak just on behalf of the group, but if any of you, Mr. Coons, any of our subcommittee members have anything to add, I'm just going to kind of give a general overview of what we talked about at our subcommittee meeting so everyone is aware. The subcommittee for physical education, health education, physical activity, and fitness, we reviewed current recess guidelines and we gained a better understanding of time invested in training and communication regarding implementation of that active recess pilot. Currently, that's in process at 7 of the 16 elementary campuses. Committee members re-emphasize that recess should provide students with choices to develop rules for play and to have the opportunity to release energy and stress. Students should not be withheld from participation in recess for academic or behavior reasons unless approved by campus administration for extreme behavior. We also shared information from the 2024 SPAPA, we call it, the School Physical Activity Policy Assessment. And that data was shared with our committee members after our subcommittee meeting for them to review. But just touching on, highlighting some of the bullet points that I thought were interesting was that we saw a 24% increase in the number of respondents reporting that schools were providing 15 to 20 minutes of recess since 2021. So compared to now, it's definitely had an increase, which is great for our students. 100% of respondents reported that all students were provided with daily scheduled recess. So our kids are getting daily, not every other day. That all the respondents are saying elementary are getting the recess. 56% were saying that school policy prohibits supervisors from withholding recess. So this data is asking the respondents to say, what policies do you have at your school related to withholding or prohibiting taking recess away? What we're seeing, though, is that there's a greater alignment that's needed between the school policies, if there are any, and district policies that we know that we don't have at this point. We have guidelines, but not specific policies. So schools may have guidelines within or policies within their school, but we just need a greater alignment. So that's what essentially this active recess pilot is doing, is to make sure that it's streamlined across, that it's equitable across the board for all elementary schools. But I feel like it's trending, by looking at the SPAPA data, that it's trending in the right direction. So we just discussed that. And February is American Heart Month, so hopefully you have your stress ball from the back. So a lot of our schools are, during February, they participate in America's Heart Association Kid Heart Challenge, fundraising for a great cause. So we would encourage you to definitely donate to American Heart Association and support your campuses doing that. We also have going on for just a few more days the 21-day snacking challenge. Most of our elementaries, I think there's just a few elementaries that are not participating. This is our very first year participating in the 21-day snacking challenge. This essentially was started up in the Dallas area, but this is the first Houston area snacking challenge that is taking place. And we've had wonderful response. So the snacking challenge is something that's done at home. The students are the parents register the students. They go home. They have emails that come through from Kids Teaching Kids. They provide healthy recipes. If they don't have the specific items for the recipe, they also give them alternatives, things that they can plug in. If you have bananas, you have granola, you can plug in the items that you have, and it'll provide you with different recipes to try at home. But that snacking challenge was done at home for 21 days, has couple more days left of that. We are going to ask Kids Teaching Kids to come give us a report after this final, they're going to do a survey at the end and see if there was, any increase in healthier choices, healthier snacks that they participated in. Anything else? How was that? Do you want to add anything, Coach Kuntz, on that? I mean, Kids Teaching Kids provided banners, they provided stickers, registration. The PE teachers provided a video. Anything else that I'm missing about that?
I know our kids, some of them have tried the recipes, have enjoyed them, and so that's been encouraging for them to get out. Plus, teach them how to cook as well, and introduction to that.
So you're getting some good feedback from the kiddos too. Awesome. All right. So we'll ask Kids Teaching Kids to come and give us a report after the parents are surveyed, and we'll see if this is something that we would like to continue. But it was definitely so far has been a great initiative. And then Kids Teaching Kids also provides funding to go back to our schools as far as paying for PE teachers that are communicating all that information, paying for their conferences, to go to TAFER, to their associations. So it's just a win-win when we look at it. Lee, Mr. Martinez, did you want to share anything about Fitness Grant?
Yeah, well, Lee's fine. I think Amanda's been working really hard with our CT, making sure that we do have the fitness gram set up on each campus. I think right now we're pretty close to everybody being able to log in, waiting on the high school and junior high part to come back. But the good thing is it's on our computers. It should not be an issue. In the past, we've had issues with how do we submit this? How do we submit it to the state? Right now, with this, it's going to be able to go right to them. And I think it's going to really increase the participation throughout the entire district. So pretty excited about that to see what it can bring to us. That's it.
All righty, next is item D3, Nutrition and Environmental Services Subcommittee.
I'm sorry, Ms. Edwards is also at a conference. So you must listen to moi again. So Nutrition Services Subcommittee, we had a lot of fun. We were able to participate at site visits to Alamo, EF Green, Sterling, and CBJ for a little bit in January. We observed students that they were allotted adequate time to eat lunch. Schools were providing one or more point of sale at lunch. The school meals included a variety of offerings which met the school meal program regulations. We definitely observed a promotion of healthy food and beverage choices, and just really great environments, even with the number of students that we saw going through the cafeteria. Committee members, did you have anything else that you wanted to add on that experience? I know we wanted to try to go back to CBJ. They were having some water issues at the moment, but overall, when we look at our nutrition promotion, nutrition as far as the environment, it was pretty fun. I enjoyed myself that day. Anything else? Let's put on. Awesome. So also wanted to share, I actually saw this on the Twitter page for Nutrition Services, and if you were at the board meeting this past month, you may have seen some of these students here that are pictured on the screen. So first I wanted to share, just celebrate, because this is Let Us Celebrate, that Francesca's Friends Farm Fresh Texas Produce Recipe Contest with our chef here in the district, Chef Francesca. She worked with any 4th and 5th grade student that wanted to participate in this contest. And what it was they presented dishes for a recipe book. And it had to be something that was farm fresh produce. And the winners actually were able to present their recipes at the February board meeting. They had 15 students submit winning recipes that included that farm fresh, that's hard to say, farm fresh produce. And if you notice there, they're wearing their customized chef jackets, a photo with Chef Francesca, and they also got to take home their very own aeroponic garden so they could grow their own vegetables and herbs. So just a pretty neat experience for those students. And then the pictures that you see on the presentation screen at the bottom highlight Goose Creek's Team Titans. It says that they sizzled their way to second place at Aramark's Culinary Star competition. This group faced off with 13 other teams. They had a theme for this competition. It was vegetarian lunch entree. They had to come up with a vegetarian lunch entree. So the Titans actually impressed the judges with their vegetarian stir-fried noodle with a Southwest twist. So we just wanted to say congratulations to those students and their instructors for their dedication. They are listening on the audio, or will be listening on the audio. And if anyone wants to follow Nutrition Services, their Twitter is at GCCISD Nutrition. So definitely check that out.
Next, we will hear from the Family Engagement Subcommittee. Sam Chapa.
Hold it far because it's like really.
Far away. So just a quick update as far as this Time Texas Community Challenge. We are trending pretty well as far as the community, Baytown, right? So FAR and Harlingen are always top performers, but we're doing really, really well. And as far as the district, Goose Creek, we are currently in second place, right behind FAR. So guys, there's only 2 more weeks left of this challenge. So if you haven't committed to it yet, please register with the QR code right there. If you need help signing up, meet me after the meeting and I can help you guys work with that as well. With the next 2 weeks, just log as many points as possible. Healthy meals, water consumption, physical activities, report those healthy actions. And you can also win the mini badges, and that will help Goose Creek try to get a little bit closer to FAR. Also, we participated in the Goose Call, a podcast. That's myself and Sherry Young from Harlem Elementary. So if you guys want to take an opportunity to listen to that, we talked about tips and tricks as a way to maximize points potential, right? So increasing points, whether you're logging in your healthy actions, reporting, going to the parks, they utilizing the observation, or utilizing the list and the maps where local parks, yogas, I think they have like Zumba classes and that kind of stuff. So if you have any questions, meet me afterwards and I can help you guys sign up with that. Also, real quick, we have the Gator Family Ride March 16th at Lee College. This is going to be led by the mayor of City of Baytown. It's a great ride. I participated in this last year with my little one. 6 miles. They have pit stops. So if you have kids that need those rest areas throughout the course, they have stops where you can take a break, water, hydrate, snacks. They have Gatorades, that kind of thing. But it's a really, really cool event, and it's led by Hearts and Hands of Baytown. So there's flyers. I printed flyers for everyone if you want to grab one on your way out. So I believe registration fees are $10 per individual, and the check-in will be at 8 a.m. and 8:45 will be the start time. So if you guys can make that as well, that would be awesome. Well, it was like 5 points. I think it was like 5.7, 5.8. But if you're not going in a straight line, it's 6 miles. So keep that in mind. It's 6 miles. But it's really, really cool. Last year, there was, it takes you through a little bit of, you start from the college, it takes you through Main Street. It takes you to the trail, that leads to the marina. You go off of 146. And I think if I'm not mistaken, it comes back to Texas Avenue. But you get to see a little bit of that trail that leads from Baytown Marina all the way to here to the administration building. It's part of that trail. It's not this whole section, but it's the part that's over there on the south side. But it's great. It's awesome. It's a great opportunity for everyone to get out there and enjoy it with their family. So, yeah. Yeah, it's really fun. I know they're trying to increase the number of participants this year. So grab some flyers, talk to your family, talk to your friends. We're trying to get... Share it at your campus. Yeah, share it with the campus. We're trying to get a large participant. I think last year, if I'm not mistaken, it was about 50, close to 50 family members, and I know this year they want to reach 100 or more. So keep that in mind, guys. And I think that's it.
Any questions for Sam?
Any questions?
All righty. If you have any new topics that you'd like to discuss in future meetings, please feel free to write your ideas down on the Post-it note provided and leave it on the large poster paper before you leave so that we can prepare a list for future meeting topics. The suggestions can be presenters or presentations you are interested in, recommendations that you would like to discuss, school health information that you would like to learn more about. As always, you can communicate via email at shac@gccisd.net.
Next, we'd like to invite Ms. Catherine Melito, Program Engagement Coordinator for Texas Commission on Environmental Quality, the TCEQ's Lead Testing in School and Child Care LTSCC program. She's going to provide some information about a statewide initiative of the TCEQ to help school and child care administrators reduce lead exposure in drinking water. So GCCISD is participating in the voluntary program to help safeguard children's health. And we'll let Ms. Melito work on, through her presentation. Here's the clicker if you want to.
Great, thank you.
Click to the side whenever you're ready.
Thanks. I know that's a mouthful, so I'll use abbreviations throughout this brief presentation. But yes, just thanks for the introduction. Again, my name is Catherine Melito. I'm the Program Engagement Coordinator for this Texas Lead Testing Program, as we'll call it. So just a quick overview of what I'm going to share today. I have a quick program overview just outlining the main components of this statewide program. Then I'll discuss a little bit about how lead can enter drinking water, as well as, generally some of the health effects of lead exposure, especially in childhood. I'll share some program data to date, and then if anyone has any questions, I'd be happy to answer those now or maybe after the meeting today. So quick program overview. So this is a statewide initiative of the TCEQ, which is the state's environmental agency. It's all funded by a large grant from the US EPA. So that allows us to provide the program to all schools within the district at completely no cost. And actually your district is already enrolled. I've been working closely with someone in the maintenance department, Mr. Mike Rasmussen. So the district is enrolled. We are looking to set up some on-site lead sampling at all water outlets within the district, starting probably around spring break. So coming up pretty quickly, but essentially it's just a proactive measure that we wanted to highlight that the district is taking, really to work to reduce lead exposure when it comes to drinking water for students and staff members. So I'm just going to quickly go through the program steps. The first one is to enroll, which the district has already done. There's a brief training that explains how lead can enter drinking water that I'll go through real quick in just a moment. You might be getting a community notification either via email or letter. That's step 3 of the program, just to let you know, hey, the district is taking this proactive measure and participating in this voluntary statewide program. Then we will take an inventory of all water outlets that students use for drinking or that is used for food preparation. So that includes any kitchen sinks. We'll inventory all of that, and then we will send in our field technicians to collect all of those samples and get them tested by our accredited lab based in Houston. And the very last step, we will send back results as well as some guidance on control measures that could be implemented depending on, what lead levels might have been detected at each outlet. So program benefits, as I mentioned, the program is completely free to the district, which is really great. It was designed by a team, with experience sampling per EPA protocol. We can really streamline multiple steps of the program for school districts such as yours. We have materials available in both English and Spanish, and then communications and technical support are available. So on my very last slide, it'll have our email address and phone number. If y'all ever have any questions about, the district's progress, lead testing in general, or anything like that, that's always a good email address and phone number to call. So now I'm just going to briefly, discuss lead in drinking water, especially when it comes to health of students. I know that the district may get water from a public water system, and the water systems do a great job of making sure the water is clean. The issue can sometimes come in more if there is any lead in maybe solder connecting pipes or in any like fixtures themselves within facility premise plumbing on campuses. So that's what we're testing for. Common problems arise again, as I said, from any lead materials in plumbing. Texas doesn't really have a ton of those lead service lines that you might have heard about in places like Michigan. So, don't have to worry too much there. We're just looking more at, that specific premise plumbing within campuses. So what can really affect lead levels in facility premise plumbing? There's multiple factors: temperature of the water, acidity, how long it's been sitting in pipes. So some schools that have already participated did see a spike in lead levels after coming back from COVID, actually, because water had been sitting stagnant in pipes for months when kids, were out of school. So did see some spikes in lead levels there. And then age of building as well, can definitely be a factor. So testing is important because, many reasons. One main one that I think, all of us here would be concerned with is, childhood lead exposure. It can impact younger kids the most. As their younger bodies are developing, it can affect them more than adults. But the CDC does state, there's no safe level of lead exposure. So we really want to be proactive and get this testing done. Lead levels can also vary from outlet to outlet. So these two pictures here were actually taken from the same school. And one, the picture on the left had less than 1 parts per billion of lead. The one on the right, was taken from a drinking fountain down the hall, and we saw elevated lead levels there. So, just shows us the importance of testing each water outlet. So quickly, program data. So there are over 26,000 eligible facilities within the state of Texas. Right now, I think we're just scratching the surface, but that's one of the main reasons why we're really excited to have your district enrolled. But as you can see, we have participating facilities all throughout the state. Definitely a good cluster in the Houston area as well. And then just results to date. So we've collected over 10,000 samples. And right now, the data is telling us that approximately 3% of samples come back with lead levels at or above 15 parts per billion, which is just a threshold that the EPA set where we really recommend some kind of action be taken if any results come back at or above 15 parts per billion. What are some of those actions that can be implemented to help mitigate lead exposure at those outlets? Number of measures that can be taken. Outlets can be converted to hand wash only stations. They can be temporarily removed from service. Some other actually exciting news: that grant that funds this program was recently updated, so now we can use grant funding to help implement control measures. So what that might look like more immediately is being able to provide the district with free pitcher water filters that are certified to remove lead. Down the line, we're kind of working through details of potentially being able to help with fixture replacement or plumbing material replacement if that's identified to be the source of lead exposure. Great. That's all I had for this evening. Thank you again so much for your time. I really appreciate it. Our helpline number is there in the top right-hand corner, as well as a good email address if you have any questions. Like I said, we're really just trying to raise awareness about the program, and we're just scratching the surface right now with participating facilities. So if you happen to know anyone at neighboring school districts who might want to participate, strongly encourage you to do that. It would be great to spread the word. I'll have our program flyer on the back tables if you'd like to grab one on your way out. Thanks. Yeah. Thank you. Okay, so I was told we have one quick question. So what can lead exposure do when it comes to childhood lead exposure? So There's multiple things, and I don't want to fear monger at all or anything like that. But just coming from the CDC, there are typically it's more of a behavioral and developmental issues that we see. So especially in kids 6 and younger, it can affect brain development, which may lead to behavioral issues. IQ issues, things more on that behavioral side of development.
Wes, did you have a question back there? Thank you, Ms. Melito. Next, we would like to welcome Dr. Ruth, Deputy Director of Cancer Prevention and Control Platform, and Myra Aquino, a Program Manager at Be Well Baytown Cancer Prevention and Control Platform, to improve our understanding of Be Well Baytown.
How about now? Oh, I can hear it. Okay. Hi, I'm Ruth Beckus. It's great to be here with you. Myra's taking my picture right now, but I'm going to make her stand up and introduce herself too. Will you just say hi? Say hi, Myra. Awesome. So we're here to talk about Be Well Baytown. Being here is actually really fun. The very first Be Well Baytown Steering Committee meeting that was ever held, that was nearly 8 years ago, was in this room right here, with Superintendent O'Brien here at the time. Mayor Don Carlos was here, and we had a great group of people. And they said, and we were like, we want to do this thing. Be Well Baytown is an initiative of the University of Texas MD Anderson Cancer Center, sponsored by ExxonMobil. And we would like to do this amazing health and wellness endeavor together and see what we can achieve. And everyone was like, okay, sounds cool. Miss Penny, were you there? I mean, yes, Miss Penny was there. So we talked about it, decided what we're going to do, and prioritize a number of things. And doing work with the school district was very high. Dr. O'Brien signed you up early for participation in that. And I actively participate in the community practice that Amanda was mentioning. I have launched 2 additional communities since we started in Baytown, and I am so impressed by everything Goose Creek CISD has done. It has really been just a joy of my life and career to be a part of Be Well Baytown and seeing everything that Goose Creek has done. It's just, Amanda herself is amazing. Lori Rumfield is amazing. And Priscilla Garza was amazing. And it's just been a real honor to be a part of this work. So I'm just excited to be here to share what you guys have done, and that we're so happy and proud to support. So I'm going to take you through, and Amanda shared a couple of things that I have on my slides, but won't go through all of them. So one, I work at a cancer center. So if you're not already familiar, why in the world is a cancer center working in schools? Probably any number of reasons, but one of them is that we know that there are many types of cancers. There are modifiable risk factors, and we know that cancer is cumulative over the lifetime. I have a PhD in educational psychology. I worked with schools for a good chunk of my career. And so why not just start at the beginning, right? And make sure our kids are as healthy as possible. And the decision we made in this room on that one of those very first days was, let's work with our families, let's work with our kids, let's see how we can support the community to be as healthy as possible. So we work in all the areas where you think we might work: healthy eating, active living, sun safety, tobacco-free living, and preventive care. And our goal really is for us to engage the community as much as possible in a dialogue about healthy behaviors, to foster multi-sector community coalitions, and to build capacity of community organizations. Our goal is for Be Well Baytown to be yours, and for you the community to love this and take this on and move this forward into the world. And we really just want to support the organizations to get all the things they need in order for that to be able to happen. These are all the places we are. This map will not help you get anywhere, but it does show you all of the different places that we are as a part of Be Well Baytown. So you can see we're in all the schools. We work with Lee College. We work with the Parks Department. We work with lots of people. Communities and schools, you used to be on our steering committee and you're not anymore. We'd like to invite you back right now. Love to have you there. Awesome. And anyone else who would like to join is more than welcome to. The more the merrier. So you can see just some of the different places we've been. We brought this 2016-2023 impact report. It's on the back. So if you'd like to take a look at it, I would love to share some of our outcomes. I really want to spend most of my time talking about the school district, but we are very proud of all the work that's been accomplished as a part of Be Well Baytown in the last nearly 8 years. We've had our 76th steering committee meeting, so it's been a minute that we've been doing this work. So you can see lots of the outcomes that are here as well. We have distributed more than 7.5 million pounds of food that's been distributed by Hearts and Hands of Baytown, and their amazing volunteer network that's supported by United Way, and many organizations across the community that has really helped to support build an entire food ecosystem. We now have a program with Hearts and Hands where they are able to connect you directly to a community health worker, and working with Harris Health to get people information about SNAP, get enrolled in that program, get access to resources. So if that's not a program you know about, there's lots of great things always happening with Hearts and Hands. I'm going to talk about all the school ones. We work with Goose Creek with UC Health and part of the HPV vaccination program as well. Work with Chambers Health and cancer screening. So lots of amazing things happening. So why does coordinated school health matters? Well, any number of reasons. You're the school health advisory committee, so you already know this, but we do know that when students are healthy, they're absent less often, they're more attentive in class, they have fewer behavioral issues, and they score better on standardized tests. So we want our kids to be healthy for any number of reasons, but also for their academic achievement. So coordinated approach to child health, you guys have done a lot. You've been very busy for the last several years. And so in 2017, we really launched the pilot catch in 4 elementary schools, and then expanded that into all the elementary schools and all the junior schools in 2018. And then we started introducing some of the other things like sun safety and HPV vaccination, tobacco control, all those kinds of things. In 2021, your SHAC was established. You had a smaller one, now you have a bigger one. We started the active recess pilot, established the cohorts, and then implemented your sun safety campaign, and then added additional programming over time. So you guys have been very busy in getting all this stuff done. And having a SHAC to support it has been shown time and time again to be an incredibly effective way for school districts to manage and sustain this work over the long term, and then see those health outcomes for forevermore. So a couple different things. You saw some of Amanda's numbers. I'm going to give you some of the since we started numbers. So you've got 13 certified Catch PE community trainers. Again, that allows for the district to be capable of doing those trainings and not having to bring Catch in to do all of those trainings. You have 24 campuses that are currently implementing Catch, and also have a SHAC within their school health community. In total, you've hosted 84 Catch family nights where you're providing information and resources to families. 4,000 teachers have been trained on Catch, and 24,000 students, of course, are reached annually with the program. In terms of infrastructure improvements, we were able to work with Peter E. Highland Center to do outdoor learning environments, ! As a program that we were able to install a walking trail and a looping path and some other things within the community. Of course, there's walking trails at 4 of the schools. There are 2 bike racks and a bike service station. There are 4 schools with active recess equipment, more to come, and 14 sunshades that have been installed, and 3 more to come on that as well. And what a sunny city we are in, so what an amazing opportunity to have us covered by shade. I'm not even going to try with this one, but this is how many different awards and recognitions Goose Creek has received as a result of all the amazing work you've been doing in school health and wellness. And this is something you guys should just be so incredibly proud of, because this is a long list, and it's a very it's difficult to compete in these places, and to get this kind of recognition is really amazing, especially from groups that are outside of the district, inside but outside of the district as well. Of course, there's been amazing work done in sun safety. Just a little bit of information. We know that we did a survey last year. 82% of respondents felt confident they could reduce their risk of skin cancer through certain behaviors. And about 90% of those who said that they knew their kids were doing a sun safety activity thought that they were helpful. So that's really great that that work is going home with students, and then their parents are also feeling like it's helpful. We're going to do that survey again. It's going to launch now. So look for that, and we'd love to have more people participate. We had about 850 people participate last year, which is really amazing. And we'd love to see that kind of participation again.
And then we also know that about 90% of K-8 students were reporting teaching at least one in safety lesson per year. So all amazing things happening. I know that you guys hear about active recess, so wanted you sort of see the change over time. So you're in FY21, you had 51% of the campuses that were doing active recess programs, and now you're at 80% of the campuses that are doing active recess programs. So it's moving over time, and that's really exciting. And studies have shown that having structured versus unstructured recess, they have a positive association between recess and academic behaviors. So you're actually seeing indicators of cognitive skill associated with that active recess. So keep it going. I wanted to share you some of the improved physical activity outcomes across just one school year, what's happened. And Goose Creek has seen this almost every year that has been implementing the programs. So you can see in the blue here, it's the October, and the question at the bottom is the number of days per week students did moderate to vigorous physical activity for at least 30 minutes. And it increased from 2.72 to 3.23, which is statistically significant. And then a similar question, number of days per week students played outside for at least 30 minutes. And again, from the start of the school year to the end of the school year, is the students taking this test, reporting on what they think they are doing, and they are reporting on even higher numbers between the beginning and the end of the school year. I think that was my last one. So just wanted to share some of those things. We are looking at some of the data from all of the years, and I'll be happy to come back and share that another year. But we saw big increases, that terrible pacer test we have to run back and forth and touch the line, between when we started and where we are now, and really seeing, again, statistically significant differences amongst the students and how they are being physically active, which is really awesome. So thank you for the opportunity to talk about all of this. Make sure you get the little carrot bags we brought also. So it looks like Amanda's bag, and then it folds down into a carrot. So just make sure you take one with you, and I'm happy to answer any questions. We just couldn't be more proud of all the amazing work that is happening in Goose Creek CISD. So thanks for having us here. Thanks for all that you do. Thank you, Amanda, for all the amazing things you do. And I'm happy to answer any questions that anybody might have. Yes. Yeah, it's a great question. Yes.
Bunch of different things, but we don't see the actual help coming to help the PE coaches and the physical metrics.
Yeah, it's a great question, and I might need Amanda to answer some of those things, but I can share a little bit about what the work has been done that's happened. So CATCH, Coordinated Approach to Child Health, is a program that's about 30 years old that's been there. Texas is actually interesting in that it requires that there be a coordinated school health approach in all of its schools. And so the way that we started this program really was with that pilot test to make sure that it was working, to your question. So what happened was we brought in a group called CATCH Global Foundation, and they did a training for the schools. And they provided information to the school professionals about what CATCH is, how to implement it. We also supported the purchase of hula hoops and balls and things for them to actually do physical activity with. So there was an assessment that each school filled in to understand what things it was that they needed in order to be really productive in PE and have some of those things. So we started there. We put in walking trails in some of those schools to make sure that there was actually a place for the kids to be able to walk. We implemented programs with the Parks Department to, again, increase opportunities for physically being able to go do some things. We supported the hiring of a full-time person dedicated in the district for the first time ever for Coordinated School Health, which is now Amanda, to provide support, to work with the schools, to be champions of this.
We also supported stipends to give the teachers that were the coordinating for that school. They actually got additional funding to be helping them to implement this one more thing that they needed to do. And then we've provided a number of different resources throughout the last 7-8 years, which I'm happy to talk all day about in terms of just additional resources for the kids. And those metrics that might not show it, but what we're actually seeing, and I can tell you looking in other districts, the kids here are being healthier. And it's a result of all of this amazing work that's been done. And so that's what all those bar charts are showing, is that the kids actually are healthier as a whole across the entire district. That's what we're really looking at. We can look at some things that Manna has as well by school, but we definitely are seeing healthy kids. And I don't know if there's anything else you want to add, but that's from our perspective at least.
The support from this initiative, bringing Be Well in, the funding in, has definitely supported, has continued to support. And now, I mean, look at our School Health Advisory Council now and the work that we're doing. It's a constant conversation now, whereas before it wasn't in the conversation. Now we're having these meetings, we're voicing our opinions. So I think not only putting the CATCH program in place, but now we're able to measure, like what you saw earlier with the wellness policy. We had the policy, it's there, we see it, but how are we measuring it? Who's asking the questions, like you're saying, on physical activity, on nutrition promotion, on other school-based activities? We have these processes in place now, and it truly is tremendous, the work that's being done. But I definitely understand the frustration that our staff, our teachers probably feel too. I mean, we have some PE teachers here on our School Health Advisory Council as well. So, but I work very closely with them. The surveys, we're getting feedback. And then in our subcommittee meetings, trying to come up with strategies that we can help specifically in this area. Ms. Times?
I wanted to say, I had a school where I had the lower level SHAC present. We didn't have PE teachers initially when we started. And so we incorporated into the classroom because we had advisory periods. And it worked well. I was one of the schools that received actually a shade screen because some of the shade screen lessons and stuff throughout the school year. So we were very successful with it. And we got a PE coach. Now, when I did get a part-time PE coach,
Perfect. Any other questions I might be able to answer? There's so much to share. I'm sure I missed out lots and lots of things, but thank you for the important feedback. Awesome. We're easy to find if you want to reach out to us anytime. You can just email us at bwellcommunities@mdanderson.org or talk to Amanda. She can track us down too. Thank you.
Yes. All right. So yes, thank you both for your tremendous support. Be Well Baytown, of all of our health and wellness initiatives and programming here in Goose Creek. It's truly incredible to see the progress that has been made. And we're so proud of you both as well for your dedication, and look forward to continuing the collaboration in the future. So if I can flip my page. Oh, Miss Dancy Robinson. She's here, right? Yes, Executive Director, Communities and Schools, Baytown. I would ask if you and your team, if y'all want to come forward for the presentation. Earlier this year, I had the pleasure of working with this phenomenal leader with Communities and Schools, and we partnered with Lee College. I just had a picture of this I wanted to share real quick. Lee College Peers Against Tobacco Group, and they taught Goose Creek students this peer-to-peer teaching about the dangers of vaping earlier this year. You may be able to expand on this, but we wanted to kind of give a celebratory thank you to student Priscilla Guerrera, almost said Garza. Priscilla Guerrera, she's a student currently at Impact, but she's also a Lee College student. That student facilitated the student group who was under the supervision of the CIS and the student wellness interventionists at the schools, both at Cedar Bayou. She did presentation and at Point Alternative High School. We're very proud of Priscilla. She's not in the country right now. She's actually out of the country in Europe on debate team, so with school. She's out, but we told her that we would, say thank you for all the hard work that she did, and she'll be hearing the audio after that. But we thank you, Ms. Robinson, CIS, for coordinating the efforts, and I'll hand it over to you for your presentation.
And thank you for having us this evening. We will be brief because I know we're going to wrap up. But for those of you, how many of you all in the room are familiar with communities in schools? Oh, awesome. Okay. So for those of you that are not, we will kind of introduce who we are and what we do. And for those of you that are familiar with us, there may be some things that you may learn new tonight. And we're hoping that when you walk away, you will have a clear understanding of who we are and what we do and how we can service the students that are in Goose Creek and also in the community as well. You got the clicker? All right. All right. So we'll start. Who are we? We are an affiliate of Communities in Schools, which is a national organization. It is a dropout prevention organization. We have been in the city of Baytown since 1994. Started out as an after-school program. Started out mainly with gang prevention, helping kids stay off of the streets, stay out of the gangs. Our national office is based in Washington, D.C. In the state of Texas, we have a total of 27 affiliates. So, and we have the most affiliates in the state of Texas. So, of course, I've heard, I am not born and raised in Texas, but when I moved here, I was told that Texas does everything big. And working with Communities in Schools, I see that we do everything big. Our mission is to surround students with a community of support, empowering them to stay in school and achieve in life, not just in school, but we are in schools and beyond. So that is our mission. We cannot do the work that we do without the support of the community, without our wonderful partnership with Goose Creek and the staff that we work with on all of the campuses. We are based on all of the secondary campuses right now. Our staff, they're doing amazing work. We have about 2 site coordinators. That is what they're called. They do case management support, and they are based on all of the high school, all of the junior high, and we have 1 site coordinator on our specialty campuses such as Impact, Peter E. Highland, and Stewart. Our core values. Our values is accountability. We want to be accountable for the work that we provide, the service that we deliver. Integrity. We pride ourselves on integrity. Collaboration. Again, we cannot do what we do without the support of the community, without the support of the staff that we work with, without our parents being actively involved and engaged in their child's education. Equity. We believe that we want to make sure that we service everybody. I know for a while people said that Communities in Schools, well, you all only work with bad children. No, we don't work with bad children. I don't like to label children as bad children. We work with all children. We work with everyone. And so we want to make sure that our caseload, the kids that we work with, that we have a diverse caseload. And excellence. We want to make sure that the work and the services that we provide, that we do it with the spirit of excellence. What we do. Ms. Helm, I'll turn it over to you.
Now, many of you that know and are familiar with Communities in Schools wonder, well, what do the site coordinators do on campus? We are here to provide support for at-risk students. Imagine how many students that we have that are dealing with so many barriers in life that they're not successful. At least about 50% of our students here in Goose Creek have at least one at-risk factor. We are there to provide support. We're there to collaborate with the schools to make sure that our students are successful. So that's what we do. Our model is evidence-based. We collaborate with school administrators to see what are the needs on the campus. And then we create a campus plan. Yes, we create our own campus plan to determine how successful we can be with our students. Now, with at least 2,100 students that we provide support for every year, each and every student gets an individualized assessment plan. It is very detailed to determine what barriers are there, what support we can provide, what resources that we can bring in, not only from Baytown, but the surrounding areas. So it is an extensive process that we do to make sure. We also monitor Every 9 weeks, we conduct things called progresses to see if the student is being successful or if there are any new barriers that we need to address. And then at the end of the year, we provide reports to determine the closeout, how successful that student is. It's a lot that we do, and we go beyond. So you will hear me say and hear us say about how you can. I need to take the clicker from them, huh? I looked over at them like, okay. So our evidence-based program, we provide support in 3 particular areas. Of course, Tier 1, which is your school-wide events that we provide not only for the district, but for families as well. And then we have our Tier 2 services, which are just groups that we provide. A lot of our site coordinators provide weekly groups to address areas that are specifically for that campus. And then, of course, we provide Tier 3, which are individualized, one-on-one support that we provide for our students on campus. This is throughout the entire year, and we make sure that we're consistent with that. It is required with TEA that we provide consistent services. You won't see a student in our caseload that gets services 1 month and that's it. We make sure and ensure that those services are provided for each and every student that's on our caseload.
Sorry. Our on-campus programs, we have the Backpack Buddy program. Our site coordinators run it on just about every junior and high school campus. This is if a student needs extra food for over the weekend, so they can make sure we get them food since they don't get to come in for breakfast and lunch. So sorry. Yeah, I can see it. I lost my train of thought for a moment. Each campus has some shelving put in so we can store it. The one we're showing right there is GCM. They have those up in GCM so they can store the food nice and neat. And then the kids come by every Friday, pick up 1 to 2 bags, and they take it home for the weekend, depending on the size of their family.
And I just want to piggyback. We also partnered with United Way for a Day of Caring. They also provided shelving in some of our schools because some of our schools didn't have the adequate shelving, which is required through Houston Food Bank. You have to store the food a specific way.
6 inches up, 6 inches away from the ceiling, and 6 inches away from the wall.
So thanks to United Way, they came in, they built shelving on some of our campuses to make sure that we meet the requirement according to Houston Food Bank.
So also, Food Bank delivers this to the Goose Crate every other week. On Wednesday mornings, we get a list, the distribution list. Once it arrives to Central Receiving, we sort by campus needs. Wednesday afternoon, we start pushing that stuff out. By Thursday morning, every campus on that list will have their food bank necessities. Once it gets to that individual campus, it is stored on these shelves where it is distributed to all the kids. And also, a lot of questions were asked as far as the kids that receive this, it's in private. So keep in mind that to deter bullying and made fun of and that stuff, all this is done in private so that way kids are not ashamed or embarrassed. And I believe you guys also give backpacks. This is stored inside a backpack that only the kid will see and the parent.
Yeah, instead of sending it out in the green bag like that, we have drawstring bags that we put it in so the kids can take it out without too many people knowing what they're carrying.
And parents are allowed to come and pick up too, because at one time I was a site coordinator at Stewart Career, and I had a lot of high school students that they didn't want to take it, whether we put it in the backpack or not, they didn't want to take it. And so the parents would come up and we would coordinate a time and they would just come up and they would pick up either a box or they'll pick up a couple of backpacks and take it home. So we made sure that those families went home with food for the weekend. It's an application. The parents have to consent for the family or the student to receive the backpack. The site coordinators make sure they advertise it on the campus. We usually put out flyers. They can make a school announcement. I know, again, when I was at Stewart, I call them robocalls. I don't know what they call them now, but the principal at the time put a message that went out, a phone call that went out to all of the parents to let the parents know, hey, we have this program on the campus. If you would like to register your child for the program, they can just sign the child up for the program.
Ones that qualify, that secretary of that campus will send that list of students to food bank, and then they get those packages ready and gets delivered.
Yeah, but a lot of parents, the last couple of years, our enrollment has dropped each of the last couple of years. So we're trying to get more parents to sign up, but a lot of parents just are embarrassed that they're having to get this program.
So again, we push it, like you said, to make sure that it's discreet because we know that there is a need. We find when we do these food drives on the campuses, the turnout is great. So we know that there's a need in the community. We just need to be more creative and be more proactive in how to get the parents engaged to sign up.
Unfortunately, I need to leave, but I just wanted to throw in a question that hopefully, if it's not answered on one of your slides, that it is answered. Being that y'all service almost 20% of the students in all, how are y'all funded?
Oh, great question. Wonderful question.
Well, you can answer that at any point in time.
Again, we are nonprofit, and so we receive funding through grants. We receive funding through grants. Yes, and the community, not just grants, but individual donors. We have partnerships with businesses, foundations. So that's how we receive a lot of our funds. I will say our top funders is TEA. We are governed by TEA, Texas Education Agency. United Way is one of our large funders as well. And then, of course, the district that we are in partnership with. So that is how we receive our funds.
I wanted to add on to this question. I'm a community health worker, but I'm here as a parent today. When I screen some of my patients, I do ask some barrier questions. And on Find Health, there is also a link that we send to our patients on their agreement to participate in the program if they're not aware of it. So we send them.
Thank you. Another question? Yes.
They're so helpful. I really appreciate it. At the one I'm at the hospital, at the elementary school, every time I call your staff, they jump to it. It's great.
Thank you. Thank you. That's good to hear. Good to know. Thank you so much.
Another program we have on campus is our Maslow's Closet. Our Maslow's Closet, we try to keep stocked with brand new clothing, shirts, pants, sweatpants, shorts. So if the kids come to school and they, are wearing the same clothes 2-3 days in a row, we'll pull them in, we'll talk to them, we'll ask them if they have a need of clothing. Right now, we have a great partnership with United Way, who anytime we need clothing for students, we just contact them and they help us out getting the clothing for the students. Usually it's a 24 to 48 hour turnover, but there are times I say, hey, we need it now. And within that school day, we have the clothing. So we've helped out probably close to 100 students this year, I'm saying. And it's growing. So, and Maslow's Closet, United Way has helped us build 3 closets right now. And I'm working with Brittany from United Way, and we're going to try to fix 3 more this school year. So.
And the whole goal of these on-site programs is to be able to supply immediate needs while the kids are in school, because kids are coming to school and sometimes, again, like you said, sometimes they're ashamed because they don't have washer and dryer at home. They're unable to wash their clothes. We've seen children come to school, they've worn a hoodie for the entire month. And then when we say, hey, do you need a new jacket? Do you need a new hoodie? Their eyes light up like, yes, I didn't know that I could get it. Our staff has even assisted kids with having to wash their clothes on campus because they don't have these basic necessities at home. And so Maslow's Closet, the Backpack Buddies, it helps us provide immediate need for the child right there on campus. So on the elementary campus, the contract workers are KAIs, Harris County KAIs worker, and they should have the same. We're reaching out with them to.
All right. We also have the Healthy Snack Pantry. This is new this year. We're trying to stock it with healthier foods, granola bars, popcorn, healthy chips, and stuff like that, protein bars. That it's still a work in progress. Like I said, it's brand new this year, so we had some growing pains with it.
We're still soliciting donations. We're still soliciting donations. One of the reasons that we started this, again, we're constantly seeing kids that are coming to school hungry. And you and I know as adults, sometimes we can't function when our stomach is growling. So imagine a child coming to school trying to sit in a class, having a test, and they haven't had breakfast. They haven't had dinner from the night before. And so this was a way of how can we provide an immediate healthy snack for this child, so that they can at least get through to their next class and then get to lunch. We also partnered this year with the nutritional department with the Second Chance Breakfast. And so we were able to have conversations with the principal, with our site coordinator to say, hey, are you interested in having this program on your campus? And the Second Chance Breakfast allows kids, if they come to school late, they can get breakfast between, first period and second period. And so that has been another wonderful asset on the campuses as well. Oh, then okay. All right. Okay. From the nutritional department. Yes. All right. Oh, next. All right. And then our last, not our last program, but another program that has been successful is our job readiness program. We launched this program right after COVID in 2021. It was virtual. We wanted to introduce college and career readiness information to our students. For some of the students, it would have been first time introduction, especially if they are first generation that may be thinking about going to college. Parents have never attended college. And so we wanted a way to bring the information to the students. What do you need to register for college? How do you even apply for college? What are you interested in? And so we started this program, received our first grant. Since then, it has grown, and we've gotten more grant funding for this program. We've expanded it this year to the 8th graders. So we're introducing it to 8th graders because as we were introducing the program on the campuses, we realized in 8th grade, you can start applying for scholarships. So what does that look like? How do we get them interested in college at 8th grade? And so we've expanded it this year for the first time to 8th graders. And so we're hoping that this program will continue to grow. Those are just some snapshots of some of our participants. We partner with Pivot Foundation, which is one of our facilitators that come in and facilitate the workshops for our students. The bottom line is students cannot achieve at their full potential without additional support. That support comes from communities and schools. It comes from you all. It comes from our grant funders. And so we want to just make sure that, as Ms. Helm said, how do we break down these barriers so these students are successful in school and beyond? And one of our models, which was quoted by our founder, Bill Milliken, it's relationship, not programs that change children. So we're all about building that relationship with the child. How can you help? What does it look like? How can a child get connected with communities and schools? These are the different ways that you can refer a child to communities and schools. Teachers can refer, students can do a self-referral, principal, assistant principal, school nurse, counselor, parent, the juvenile court, law enforcement, CIS staff. These are the different ways that a child can be referred to our program. How can you get involved? We're always asking for mentors. We're asking for tutors. We're asking for volunteers. You can sign up. We would love for you to come in. You can present. You can be a guest speaker. You can volunteer at some of our events. At the beginning of the year, one of our annual events is our back to school supply. We give away backpacks filled with school supplies. We partner with the city of Baytown. This past year, we gave away over 1,000 backpacks filled with school supplies. And so that's a way that you all can volunteer if you would like to.
So every year we get impact statements from faculty, staff, and then our students. It is so overwhelming to have a student to come back and say thank you. I've been with this agency about 22 years, and to have someone to come back and tell us what CIS did for them, on how they moved on and they were able to go to college or able to just remove some of those barriers. So we celebrate not only the students, but their families. At the end of the year, we'll have our end of the year celebration where we take the opportunity to recognize those students who have gone through so much and made it. It is a beautiful event that we have. It's a sneaker ball theme. So if you all would like to come, Dr. Times comes faithfully every year, and I want to thank her for that. But it allows those, because one of the barriers for our students is a lot of them don't have, really nice clothes. So we want to make them feel comfortable. So we chose that theme, and to have those students come and be celebrated with their parents is the most rewarding thing that you could ever have. But we have impact statements that are on our Facebook pages that you all are more than welcome to read and see on how we make a difference with our students. So this is something that we do. We provide to our stakeholders as well, so they can know what we do for our students and how much not only do they mean to us, but what we mean to them. So our motto is all in for kids in schools and beyond. Just because the bell rings at 3:15 and we see teachers leave at 4:30, some of us are still there because there's work that needs to be done. There are a lot of site coordinators and, of course, our staff that go beyond that call to make sure, like Ms. Robinson said, we've washed clothes. I've been one of those site coordinators that faithfully washed the students' clothes every week. No one ever knew it because I wanted to make sure that student felt comfortable in the classroom. We have site coordinators that have driven to Prairie View A&M to turn in an application to ensure that that student is in school. We've had site coordinators to meet with parents to provide Thanksgiving baskets, Christmas baskets. We do angel tree donations. There's so much that we do. We also bring in the community to do enrichment activities. We had our successful one-on-one basketball event last year where our superintendent was the star player and did an awesome job. To have students play with the superintendent on the court in basketball, that meant so much to them. So we're all about going beyond what we need to do to make sure that our students are successful. Our goal is to make sure that we see each and every one of our kiddos walk across that stage. And we're there. We're there to celebrate with the parents. We're there to celebrate with you all and them.
All right, our results from 2022, 2023 are, we had a 94.4 improvement in academics, 79.8% improvement in attendance, 93.4% improvement in behavior, 100% of our caseload stayed in school, 99.3% got promoted, and 93.3% graduated.
And these outcomes are, again, we're governed through TEA. Our data system, all the services that we provide is entered into a data system that was created by TEA. So they send us our results at the end of the year. They calculate and send us our results. So it's nothing that we can, I guess, put in ourselves or try to make it up. All of this, again, is governed by TEA. So thank you so much. Does anyone else have any other questions? Yes, ma'am.
You mentioned that you got a grant to help kids apply for college and help with their FAFSA stuff. Where is that grant?
That was our CDBG grant with the city of Baytown. That's through the Job Readiness Program. So that's how we facilitate all of the workshops to help them prepare for college or careers. No, it's not connected through the work source. We have partnered with another foundation called Pivot Foundation, and they come in and facilitate the workshops for us. Yes.
Thank you so
You're
much
welcome.
for
Thank
all
you
that
all.
Thank you, Ms. Robinson and Communities in School for your support of our school community. We're in the final few minutes of our meeting. I want to remind our members that the final SHAC general meeting of the year is scheduled for April 28th, 2024 from 5 to 6:30 in person here in the administration building boardroom. We encourage members to participate in upcoming campus and community events and activities as shown on the presentation slides, such as family night, a color run, walk and bike to school events. On the next slide, it'll be the Children's Assessment Center is offering free virtual workshops open to parents and educators regarding child sex trafficking response. Ms. Casey Pena, will you share your role and tell us about the 211 resource and any additional information you would like to share?
Yeah. So my name is Casey. I'm with United Way of Greater Baytown Area in Chambers County. I'm also really loud. I don't need this. It's okay. But 211 is, every state has a 211. It's a hotline that has resources available. So for our state, 211 covers the entire state of Texas. So our United Way is really small. We play a small part in 211. For reference, I have a team of 6. 211 has over 90,000 services available throughout the state. So it's a great way to help individuals find easy access to things they may need right now. So I have some cards. I want to pass these out. These are a great resource if you come across somebody who's like, I have no idea what to do. You can always call us, but 211 is a great resource as well. And in these packets, there's also a card for single care, which is a prescription aid card. It's similar to GoodRx. Also a great resource. We always have these in our office, so if you need them, if you're in the school building and need them, please contact me. I'm more than happy to give you some so that you have them on hand. We also provide them to other resource providers and first responders in the area so that they're always accessible. Our goal is to get as much information about 211 and single care into our community as possible so people always have a resource in time of need.
Thank you.
Any questions?
And we'll have them, I guess, right here at the back table too. Yes. Yes. SHAC member there. Okay.
Is it the 23rd? April 23rd, 2024 from 5 to 6:30. Perfect. Thank you for that call out. Thank you, Casey. Members, please remember to leave your suggestions on the large poster up here before you leave. Also, if you did not get a chance to sign in and arrive late, just please come sign in. We got the correct count, but we still need your signature. And Mr. Reed?
Thank you all for a very robust meeting. The third SHAC meeting will now be adjourned. It is 6:34. Have a great night. Y'all drive safe.